treat or even before we access the lameness in an animal. You cannot access a lameness in an animal without having its anatomy in your mind. So there's, I know there are very fine details, but I want you to remember like 4 things. Number 1 is what we call hoof wall. The hoof wall. Remember we are talking of a ruminant, A ruminant, sindio? Yeah. So for a ruminant, we have what we call hoof wall. And we have what we call medial and lateral hoof wall. And then we have something that you should also remember is what we call hoof sole. Huko chini, the soft tissue is what we call the hoof sole. And then there is another structure, a very important structure called the petal bone. Chini, we have, I don't know whether it's visible. From the structure here, we have the, I don't know if I can use my pointer. It's not visible. So basically, okay. So this is the hoof sole. This is the hoof, the hoof wall. Sorry, the hoof wall. And then underneath the hoof wall is the sole. And this sole is now the soft tissue that serves us most when the animal is under a lot of pressure, especially during lameness. Are we getting? And then there is a very important structure here called coffin bone, or the petal bone. That's the one I was talking about. And then from the word laminitis, itis means inflammation. Sinukweli. So when you say laminitis, it means an inflammation of the lamina. Sinuvo. Now, where is the lamina? The lamina is just here. It actually binds the hoof sole to the petal bone here. Are you getting? So that is now the lamina. So when we talk of laminitis or lameness, it means it's something that is mostly related to the lamina. And then another structure that's of great importance, there is a small structure here called distal sesamoid bone, or navicola. So those are some of the things that I really wanted you to remember before treating this, before even having encounter, before doing anything to do with treatment of an hoof. There is also another good structure called flexor tendon. Flexor tendon. That is, I think it's here. Yeah. Deep digital flexor tendon. That is used for flexing the hoof when the animal is in movement. So those are some of the things that I just wanted you to remember. We might have other things, but have those ones in your mind. And then we also have the white line that will come later. Now, as I've said, before you do anything to do with hoof, you should have anatomy in your mind. So having that in your mind, you will now be able to access the lameness in an animal, and even after assessing the lameness, you will be able to treat that animal. So
Haya. Sasa, God is good. God is good. For the purposes of who are online, sababu hatuna mic ya kutuma signal yenye ni digital, itabidi tunyamaze kabisa ndio wasikie, sababu itachukuliwa hapa. Ndio tusikae hivyo, tuendelee kabla tusome mambo ya generator. Si uko na sauti kubwa? Tuendelee kuendelea. The presentation will be sent in a WhatsApp group. Kama hauko WhatsApp group ya Eldoret, ukitoka uniandikie namba yako pale uweke. So that for reference, I'll send you those presentations. Is it in order? Tunyamaze vizuri. Ndio wasikie wakiwa huko.
Okay, so I don't know what I'm what the point now. Yes? Yes. Kama naweza kuwa na trainer kuja translate. Tunasikia yake inaweza fika huko. Eh? So we were talking about the hoof anatomy, and I think vile tulisema kila kitu iko hapa, si ndio? And we say that for you to approach any clinical case, any hoof clinical case, you should have that in your mind. Ndio? Now, so having said that, we know that we have some routine management practices that we have to do for us not to get into a scenario where we have lameness even in our farms. So first of all, there is this routine practice we normally do, the hoof trimming. And what I know is that hoof trimming should be a routine practice, not a clinical intervention, actually. So, but you find that in most cases, we do hoof trimming when there is a rise. But doing this as a routine practice, I think it's something that most of the vets or even farmers find it cumbersome. So, hoof trimming should be something that should be done maybe twice a year to avoid overgrown hoofs, so that we avoid you remember the structure of the hoof walls. So the hoof wall, there is what we call hoof horns. So the hoof horns may overgrow, then animal will have issues. So we should do what we call routine hoof trimming. That should be maybe once or twice a year. And in most cases, this practice should be done for the animals that are zero grazed, because we understand the structure of zero grazing. There is concrete wall, concrete floor, and all that. But for the pastured animal, at least they are working on a carpet, a soft ground. But then that doesn't mean we should not do what we call hoof trimming. It should be the hoof owns that I was talking about regenerates, and therefore this hoof trimming should be done regardless of where the animal is. But in most cases, those in zero graze should be are predisposed much to lameness cases because of the structure and also the body weight of the animal. So, having said that, we have to know that in most cases, what we encounter in the farm is what we call laminitis. So, that means even if we are talking about the maybe injuries and all those, we should also factor in the nutrition part of our management, because when we talk of laminitis, it is a metabolic disorder. Rather than it's a non-infectious case for this matter. It's a metabolic what? Issue. And when we talk about metabolic issue, then nutrition plays a major role in countering such issues. So we should have in our mind that as we talk of laminitis or lameness issues, we should not focus maybe on the structure alone, but also on the nutrition management of the animal. So as I was saying, as I was talking about the hoof trimming, I was saying it's a routine practice actually that we should do, but we find it a cumbersome activity because maybe of the process that involved. So in most cases, maybe to condition or restraining of the animal. Actually, me, I think I've tried one, and I don't want to tell you how it messed me up because it almost went with my tender formula. Yeah, you know that thing. It's very sensitive fast to do. Yeah, so if you go with something that is blind, for that matter, jaribu kukata hivi, ufike the soul. You remember where the soul was, ndio? Ukifika the soul, which is the soft tissue, you inflict pain kwa ng'ombe, and the next thing is what? Yes. So I think that is one of the reasons that we find it, this thing, hoof trimming, very difficult. But it should be done anyway. Number two, remember, the soul also is a very sensitive bud. And then the lamina, where we were saying laminitis, where we say laminitis occur, is also vascularized. And when we say vascularized, it means it has blood vessels in it. So something with blood vessels means that if you don't do this thing right, you might end up doing even more injury to the animal, because unaweza kata ng'ombe and then you find yourself the animal is bleeding a lot. So those are some of the precautionary measures that you should take when you are doing hoof trimming. Another thing also that we should note is that every time you are doing hoof trimming, you should use something very sharp and something also that is sterile for that matter, because we don't want to instead of correcting a menace, we are also creating another issue, because if you are using something, especially the hoof trimmers, they are most of them are made of iron, and in most cases you find there is rust. So those are some of the things that we should also avoid, because we don't want to cause another infections instead of correcting an issue. So I've talked of using clean equipment when doing hoof trimming, and then also I've talked of the frequency And when I said for the routine management, we should do it once or twice a year, especially for the animals that are in zero grazing. Now, there are some images now that we can't do without them. I don't know. Yeah? But now explanations are based on what we are going to see. Yeah? Unasemaje? Yeah? We skip. Yeah? Michore. Yeah? Okay, let me just try to. There was what we call imagery in English. Yeah? You talk as if you are throwing something. Yeah? But of course you have the anatomy in your mind. Now, when you have laminitis coming in, because now I'm done with the routine management practices, we are now going to Lameness. So, remember, when an animal is affected with either laminitis or foot rot or all hoof-associated issues, I talked about hoof sole. I talked about the lamina, and I talked about the white. There was a white line somewhere, and then now there is what we call chorea. That is the lining of the heel sole. Now, I say the lamina because of how the hoof is structured. The lamina is a line. Actually, it's a connective tissue that lines the hoof wall and the coffin bones. Now, in between these connective tissue are vascularization. That is blood vessels. Are you getting what I'm saying? Now, when the lamina is affected, when we have laminitis, that is the inflammation of the lamina. In the morning, we talked of the cardinal signs of inflammation. And we say that one is what? Yeah? There is pain. Yeah? There is pain. There is swelling. There is what? Yes. Hey, I think what you are saying is you are all right. Yeah? Because mwingine anasema swelling, mwingine anasema pain. So now, inflammation, tulisema kuna hiyo swelling. Now, when the lamina is swelling, na ina space hapo katikati, what will happen? Remember, it is in between two structures, but now it is inflamed. That means it should be swelling. Are you getting what I'm saying? Now, because of this swelling, and there is no enough space, it means the blood vessels running alongside this connective tissue will be what? Yes, will be destroyed. Now, when now the blood vessels are affected, what will happen? There will be a lot of hemorrhages in between the connective tissue, the lamina. Now, what happens when a blood supply to a tissue is cut off? What will happen? Necrosis. It will die off. When the blood supply to a tissue is cut off, that means that tissue will not get nutrients and will not get what? Oxygen. So it will not survive. So what will happen? It will undergo what we call necrosis. Now, when the lamina is now necrotic, it means that because now it was acting as a bind between the basal bone and the hoof wall, that means that attachment or the bond will be weak. So what will happen is the basal bone, kama mliona mahali ilikuwa, it means it will now have a lot of space hapo ndani because the bond between the structure and the hoof has been what? Destroyed. Sindio? And that is what we, and then it will now make what we call rotation. There is what we call basal bone rotation, because there is no more bond between the same structure and the hoof. So that's what basically what I was talking about. So there will be. So I was talking about the changes. One of the changes is what? Hemorrhages. Number two is what? Necrosis. And then number three now, the basal bone will be rotating because there is no what? There is no attachment. Of course, hii inafanya peke yake. Yeah? It's a display. Because so basically what I'm talking about now is we are going deep into lameness. And I was saying, how do you know that an animal is lame? Of course, you still remember the scores. Sinukweli? Yeah? The lameness scores, where you access the severity of the lameness based on what we call a scale of locomotion. Scales of locomotion. Because so before to pick up, I think this was the slide that I was trying to put an image in your brains. So this is what what normally happens when laminitis sets in. So we were talking about the soil hemorrhage. We were talking about the necrosis of the corium. You see? So we have the corium necrosis and hemorrhages, and there is now the clone bone rotation, because now this is where we are the structure, the petal bone. Yes. So because now the attachment, the lamina here has been affected. It has undergone necrosis. It means that the binding or the bond between this structure and the hoof wall has become weak, and therefore the petal bone will be rotating in the hoof. So that's basically what I was trying to say. And then of course, for those of us whom we've tried to do hoof trimming, ukikata huko chini, ukisafisha kwanza na ukata huko chini. As you can see, this is the hoof from underneath. From underneath, there is the hoof wall, which is the lateral side, and then up and down is the medial hoof wall. Now, the white line is just here, and also it's a very important structure that we'll talk about later. So when the hoof is affected, there are a lot of changes inside. Now, we were here and we were saying, when you are going to access an animal, of course, we have to use some merits. And we are saying, when you are assessing the severity of the lameness, you use what we call the locomotion score. The locomotion score, or the scale, where we scale or we score the lameness on scale of 5. So, between scale 1 and scale 3, between scale 1 and scale 3, or score 1 and score 3, is where we have what we call mild lameness. Mild lameness. That is from 1 to 3. Mild lameness, or something we can call it subclinical, for that matter. We call it subclinical because the animal is not showing a lot of lameness issues. So for score number 1, the animal is we consider the animal is normal because the animal is standing and can walk with normalcy. Hana issue. So that one is scale number 1. Scale number 2 is where you have now the lameness symptoms coming in. And for scale number 2, you love the animal. Wakati unaona ng'ombe anaamka, there is what we call nodding of the head. Yes, because of the pain. Hiyo peke yake. But when you look, when the animal is feeding and doing all that, ana shida. And then we have now scale number 3. That is now when you can now say, I think now this animal is having a lameness issue. Because now it's moving from subclinical. The animal is now transitioning from subclinical to clinical, because there are some signs now that you can see and say this animal must be having an issue. So as you can see, for scale number 3, we are told that for this one, we have the animal is moving with short strides, compromised walking. Short strides. Hataki kutumia sana, hataki kuweka weight sana kwa the affected hoof. So the cow is making a short strides as it walks. That is in scale number 3. And in scale number 3, there is now, the back is now aching when the animal is moving. The back of the animal is aching. So there is ached back. Now, in number 4, that is now when you can say there is a pronounced lameness, because the animal is having the ached back and also favoring the affected limb and also reluctant to move. That is now the clinical. These are this is now the what you call it, pathognomonic sign of lameness, sindio? Because now the animal is even reluctant to move, there is an ached back, and the animal is favoring the affected limb. So that is for scale number 4. And then scale number 5 is the chronic lameness now, where you have the animal showing a lot of severity in terms of lameness. The animal is even, leave alone, reluctant to move. Ataki kabisa, because the animal is having a lot of pain, and therefore the animal cannot move. Now, having said that, there is an image of an animal there. I don't know whether it's okay. I know you can see. Now, hiyo tunaweka scale ngapi? Based on what we've discussed. This one is scale number 4, because 1, there is ached back, sindio? And who can tell that which limb is affected? Yes, the right hind limb, sindio? Because as we can see, the animal is trying to favor that leg, sindio? So that is now scale number 4. And then this is just comparison between the lame hoof and the normal one. So for number one, you can see it's non-laminitic, and then this one is sinking because the inflammation is setting in. The inflammation is setting in, and a cross-section cut will reveal that the lamina is already having some issues. And then the rotation now, which is the last phase, because when the lamina is affected in phase 2, it means that attachment, ile tulikuwa tunaongelea, means that the distal bone is now not attached, or there is no bonding between the distal bone to the hoof wall. Yes, we come here now. Laminitis. And as we said, laminitis is a non-infectious issue. So that means when you are treating laminitis, you cannot use antibiotics as a primary treatment intervention because it's a non-infectious. Sinukwele, it's something metabolic. So for this case, we are saying for laminitis, the lamina or the lamella is affected, which is the connective tissue that holds the petal bone to the wall of the hoof. So as I've said, laminitis is a metabolic disorder. Sawa sawa. And then, of course, now we have opportunistic pathogens that will take advantage of laminitis. When laminitis sets in, of course, because of the hemorrhages and ulceration of the sole, that means the hoof will now be open to any other pathogenic bacteria. I don't know whether we are getting. I said we cannot use antibiotic as the primary intervention because it is a non-infectious. But that doesn't mean you cannot use antibiotic when handling the case of laminitis. It is not only the primary, but then because of the pathogenic bacteria that will take advantage of the ulcerated sole, that means there will be an infection that will come after, and therefore you should use antibiotic alongside the metabolic intervention. Sawa sawa. So that is it. So severely affected cattle will be acutely lame because of the severity, and but in some cases we have many animals that have lesser degree of lameness. The effect of laminitis can be manifested in a variety of foot disorders that appear as ridges along the foot wall. I think basically what we are trying to say in that paragraph is that how laminitis sets in, and okay, so basically what we are trying an animal is affected with lameness, all four feet are usually affected for some degree. So there is this case that Laminitis occurs mostly around calving, when the animal is in third trimester, or when we are steaming, or when we are drying off the animal. That is when we have a lot of laminitis cases in the farm. And because this is an engagement session, what do you think is an attributory factor to that case? Yeah? Someone to ask, to comment. I'm talking about the bullet number 1. Why do we have laminitis cases mostly coming in when the animal is almost calving? Yes. You want to say something? Yes.
I think as a result of probably poor feeding, excessive carbohydrates during steaming.
Okay. Anyone with a contrary opinion? Yeah. Okay. What he's saying basically is that when the animal is around that time of calving, we put a lot of concentration in terms of feeding this animal with maybe a lot of concentrates, and therefore that is the case. Is that the case for anyone? Everyone? Musembi, Dr. Musembi, tick.
I'm saying increased demand for calcium.
Yes. Dr. Musembi is saying that there is increased demand for calcium. So we have to do two comments from our seniors here, and I think both of them are right, because when you talk of concentrates, we normally give a lot of concentrates to animals in third trimester. Sindio? Unasema musipe proteins mingi because kutakuwa na ile overweight. Sindio? So you tend to rely on more concentrates. So by having this concentrate, remember, we are going to see how laminitis comes in, and you will see that concentrate plays a lot in terms of this thing. So as we've said, laminitis can get into the farm. It can affect the animal because of nutrition. So nutrition plays an important role in laminitis, and but then we also have environmental factors. So we have two factors. Number 1 is nutrition, and number 2 is environmental. But then I think 90% of the cases of laminitis is because of the issue of nutrition rather than environmental factors. Because for the environmental factors, we'll only have animals that are inside the stall because of the hard service, and also maybe standing on a hard surface for a long time. So laminitis will come in. So actually the pathogenesis now of laminitis. How does laminitis occur? So as we've said, laminitis must come in because of the nutritional issues. So we have both the nutrition and environmental factors. But the nutrition component of laminitis centers on drop of pH. Because we are using concentrates, or rather the starch for that matter, we'll have issues with rumen acidosis. And when rumen acidosis comes in, that means we have a lot of lactic acid in the rumen. A lot of, or we can say excessive lactic acid in the rumen. And when we have excessive lactic acid in the rumen, we get into this rumen acidosis. What normally happens when the rumen pH is less than 6? What normally happens? One is that the microbes, the normal microflora, and even the pathogenic will be killed. Sindio? Now, the negative, the gram negative bacteria in the rumen will produce what we call endotoxins. And then the gram-negative will produce what we call exotoxin when they are killed. And these toxins now are the one associated with laminitis because they directly affect the coronary band or the corium of the hoof. Sawa sawa? Sijui kama tumeelewa vile inakuja. So one, we have lactic acid in the rumen. When we have lactic acid in the rumen, the pH of the rumen will be what? Itakuja chini. Na ikikuja chini, inaua bacteria. Sinu kweli? Ikiua bacteria, the bacteria will produce the toxins, which will then work on the coronary band or the corium of the hoof. And then laminitis sets in. Sawa sawa? So basically that is what we are saying. So acidosis, we said they arise from as a result of that contain too much starch, the concentrate that we are talking about. So we have the starch in the rumen, which is broken down, and this produce what we call the lactic acid. So this is the slide that I think I've much talked about. So the lactic acid in the rumen will therefore kills the bacteria, the population of it kills the population of rumen microbes. These microbes, when they are killed, they produce toxins which are responsible for the changes in the corium or the coronary band of the hoof. Now, we also say that apart from these nutritional factors, we can have environmental factors causing laminitis, but not to the extent kama ile ya nutrition. Sawa sawa? So the major factor for laminitis is nutrition. But then environmental factors inaweza changia. So environmental component related to incidence of laminitis center around excessive standing on the concrete. Standing on the concrete. Remember the structure of the hoof. Uko chini ni soft because of the sole. Sindio? So when we have these animals standing for a long time on a concrete, then it means a lot of pressure is put on the sole. And there is high chances that there will be sole ulceration. So they're related to uncomfortable stools, overcrowding, heat stress. We also have long parlor hold times. Okay, that's it. So, in a nutshell, this is basically what we were saying. I don't know whether it's a graphical presentation or something like that. So here, so we have the carbohydrate overload, what you normally call grain overload. Sindio? So when you have grain overload, that means the animal will have a lot of concentrate in the stomach. I think this case ya laminitis sana inakuwa wakati watu wamevuna mahindi. Sindio? Na wanaachilia mahindi wanaenda kwa shamba. So unapata ng'ombe wanaenda kukula mahindi mingi, sindio? So they will have a lot of issues with grain overload. So when you have the grain overload, or actually the carbohydrate overload, then you will have a lot of undigested carbohydrates and all that in the stomach. And we say, when you have the rumen doing what we call this fermentation, the fermentation process in the rumen will lead to production of what we call lactic acid. And then the lactic acid will then work on both, because lactic acid, aita selecting the normal flora. This one is not the normal flora. Sindio? Bacteria and bacteria. Sinivo. And therefore, it will act on both the gram negative and also the gram positive. And as I said earlier, when you have the lactic acid working on the gram negative, they will produce what we call endotoxins. But for gram positive, they'll produce what we call exotoxins. But toxins are toxins. That is the bottom line. Sindio? So the toxins now will work on the lamina, and then we have this case of laminitis. So basically, that is what we are saying in that structure. Okay, because now this is we say this is a metabolic issue. Prevention will be centered on the metabolic issues, on the nutrition management, because it is a metabolic what? Problem. So if it's a metabolic problem, that means when you are doing prevention, your intervention should center most on nutrition component of the animal, because basically what we are trying to say is that we want to prevent the animal from having a lot of acid maybe in the stomach. So we are saying you ensure that the diets for lactating cows contain a minimum of 19% ADF and 28% NDF. What does ADF and NDF stands for? Yeah? So remember we are talking about acid in the stomach, lactic acid in the stomach. That means when we are talking of prevention, we want to counter the production of this acid so that we have maybe a neutral pH in the stomach, so that we don't kill this bacteria to produce the toxins. Are you getting? So we are saying you have 19% of ADF. ADF means acid detergent fiber. Sawa sawa. And then the NDF is the neutral. And all this is centered on issues on these are the factors. The ADF and NDF are factors that determine the digestibility of the feeds or forages that we give to our animals. When you talk of ADF, we are talking of things like cellulose. We are talking of cellulose. And when we talk of NDF, we are talking of hemicellulose and lignin. Cellulose and lignin when you talk of digestibility of cellulose and lignin, haikui digested sana kwa nini? Kwa mwili. Sawa sawa. So we are saying you should have more of ADF and 19% of ADF and 28% of NDF. Okay, in simple terms, we are saying ADF and NDF determines the digestibility or the quality of the forage that we give to our animals. The more they are digestible, at least there will be less production of what? The lactic acid. Sawa sawa. So that is what we are saying. So you also access the feeding patterns to determine if there is evidence of sorting or slack feeding. Optimize transition cow health. This is now where we are talking about the issue of laminitis coming when the cow is almost calving. So we are saying you optimize transition cow and comfort, particularly the first lactating avers, because these are the animals that normally have these issues. So now what we do then? How do you optimize? Because we want to reduce the concentrates that we are giving to the animals during that calving period. What do we do? Yeah? Okay, for Atlantis, we've come up with a product called White Energy. So that instead of having more dairy meal on a dry cow, you use what we call white energy. This white energy is a rumen bypass fat, and it will give even more energy that should have been given by the concentrate. So what am I saying? It means when this product bypass the rumen, there will be no fermentation. Are you getting what I'm saying? We are trying to avoid the fermentation of the concentrate, to avoid production of lactic acid. So what we do, we use a product that will bypass the fermentation so that there will be no lactic acid production. So you use white energy that will bypass the rumen and inaenda direct to the bloodstream kwa ng'ombe, and it will give even more energy, more than what could the concentrate could have given to that cow. So we are trying to optimize the transition cow health of that animal. And then you also provide comfortable stalls. We said environmental factors also inachangia. The environmental factors pia inachangia. And so what we do, instead of having a rough or hard concrete floor, you introduce the mattresses for the cows. I've seen there's a certain farm I saw, nowadays wanaweka concrete, alafu wanaweka the wrapper, hii tires ya gari juu. Sijui kama mumeona such farms, yeah? Because that wrapper lining will then cushion the hardness and even the pressure from the weight of the animal. So that is basically what we are saying. You provide a comfortable stall and also reduce the overcrowding. So continuation, we are saying you resurface floors that are slippery, because we don't want to have these animals getting injured in the farm. So you resurface floors that are slippery and potentially traumatic. Remember, we are saying laminitis sets in because of the soil that is affected and also the lamina. So we are saying you have to minimize the traumatic substances in the stall, and also wrapper flowing. This one will then assist maybe to reduce the cases of a lot of pressure being exerted on the hoofs of the animals by the rough or the hard floor. You also implement a routine trimming, and we've said that for prevention, you do it as a routine practice, maybe once or twice a year. It should be a routine practice, and we say that you should maintain the proper close shape, and also when you do what we call hoof trimming, actually you are trying to balance the weight of the animal being exerted on the hoof. Sawa sawa. And then if possible, you group fast lactation efforts together to minimize what we call social stress. And I think this one tulisema hapo tukiongelea mambo na concentrate. You minimize its stress and fly exposure. You minimize the time cows spend in the barrier holding area and look up for management purpose. Tulisema ng'ombe wasisimame sana, especially on the hard surface. So at least the animal should be moving, and then you minimize stress and standing time. You minimize stress and standing time. There is something that yenye imekuja kwa akili hapa on standing time. If we may go back to mastitis case, how many minutes should an animal stands after milking? Nilikuwa nimesahau your point. How long does it take for a sphincter muscle, the teeth sphincter muscle, to close completely? 8 to 10 minutes. So kama mkulima anakamua ng'ombe alafu anaenda analala chini direct, inamaanisha huyo ng'ombe atalala kama the canal is still open, and there will be high chances of cows or an animal having what we call ascending infection. Okay, that was just by the way, but it's an additional point to maybe prevention of mastitis. So, the underlying cause of laminitis occurrence should be addressed first. Here, the underlying cause is the nutrition case. We said it's a metabolic problem, and therefore, the primary cause should be addressed. So the primary cause is the nutrition, and therefore it should be addressed first before you do any other intervention. That is why I said, when you have a case of laminitis, wezi kimbilia penicillin peke yake or tetracycline without addressing first the primary cause. That is the metabolic issue. And then we have a specific treatment at the foot level. The specific treatment at the foot level is aimed at correcting, trimming, to reshape the claw so that the weight is distributed appropriately across all weight-bearing surface. And then if there are specific lesions, such as white line ulcer or sole ulcers, should be addressed. So what we are saying basically is when you have a case of laminitis and you are trying to do an intervention, you first address based on metabolic cause. And then after that, you now come to other cases like sole ulcers. So when you have sole ulcers as a result of laminitis, then you come now with antibiotics because you want to treat the pathogens that are now taking advantage as the secondary infection. So basically, that's the product I was talking about, the white energy. The animals that are much predisposed to laminitis are the animals that are in third trimester. Sindio? Wale wako 7 months, hold pregnancy. Sindio? And it's because of the concentrate that we expose to this animal. So what we are saying is, this product called white energy is able to give the animal the energy required without undergoing fermentation. So what we just want to skip is fermentation. So you replace the concentrate product, but the animal will still get the energy required without getting into fermentation. And therefore, we will have saved the animal from lactic acidosis or the lactic acid in the rumen because of the fermentation. So we are saying white energy, this is a nutrition supplement. Na isi chumvi. Nimesikia wakulima wengi wanaulizia white energy, wanatumia white energy kama chumvi. This actually rumen bypass fat, ni mafuta. So the white energy will be used by the animal to get the sufficient energy required without undergoing any fermentation. And also, a point to note about this product also is that, remember, when the animal calves down, the energy demand by the body supersede the energy supply. Sinukwele? Ngombe akizaa tu hivi, the energy demand is very high, such that whatever we give to these animals in feeds is not sufficient to meet the energy demand. So what will happen? Because you are giving the animal insufficient energy, ngombe atachitafutia. Na atachitafutia namna gani? Yes. The cow will be forced to use the body reserve. And the body reserve here, we are talking of the fats in the body. The fats in the body will be metabolized to produce the energy that is required by the animal. What will happen with the body reserves after 1 or 2 weeks? It will be depleted. Atakuwa amemaliza mafuta yake kwa mwili. And that is why unapata ng'ombe amezaa and within 2 weeks or 3 weeks amekonda sana. Lakini anakula kidogo, sasa ukienda kupima temperature iko sawa. Na mkulima amekuita na kuambia ng'ombe yangu alizaa wiki 2 lakini maziwa hata haifiki lita 2 na amekonda. So in most cases tunakimbilia mambo na hardware disease. Tunasema ng'ombe alikula sengenge nini. But in the real sense, the animal, because of the energy demand, which is very high, and the energy supply, which is not enough, akachitafutia kwa mwili yake. So ni kama anachikula, because he's now metabolizing the fat reserves in the body to produce the energy required. So after 2 weeks, the fats in the body or the energy, the reserves in the body, itakuwa imeisha. Sawa sawa. And in most cases after 2-3 weeks unapata hata ng'ombe wengine kama ni wale wakubwa sana wanalala chini. And then what you do? Calcium. Huyu ng'ombe tu si alizaa wiki 2 na amelala chini, unakimbilia calcium. Calcium, borogluconate, asimami. Si tumekuwa na hizo cases. Unampea calcium amemaliza 2 lakini asimame. That means the cow has enough calcium. But the issue you are addressing is not calcium, it's energy. Sawa sawa. So what we are saying, white energy also can also be used to prevent such cases, because when you steam the animal, when you use the white energy, which is the fat, nimesema ni mafuta, sindio? That means instead of the animal using its own fats in the body, it will be using this one. So haitachikula, inatumia hii, lakini isi chumvi. You are just replacing the fats that the animal could be using to produce the energy. Sawa sawa. So you may not, you are preventing the animal from coming down with ketosis, for that matter. So the case you are addressing is ketosis. So this is a supplemental fats, and we're saying to continue a practical means of sustaining energy index in high-producing cows. In early lactation, most cows will lose weight. I think that one we've said. Most cows will lose weight because of the energy intake. The energy intake is less than that needed to meet the nutrient demand of milk production, and therefore the animal will be forced to use the reserves in the body. As a result, the cow mobilizes both the nutrient reserves, we say that, and therefore to meet the energy demand, which may result into ketosis. And the clinical sign of ketosis, one, apart from losing body weight, there is what we call there's a smell of alcohol for those of us whom we know. Sindio? Ukikaribia ng'ombe kuna smell of ketone. Are you getting what I'm saying? Na number 2, ng'ombe akipewa chenge ama chakula anainusa na anaacha. That is a clinical sign of ketosis. Ng'ombe unampea tu dairy meal vizuri, anakula kidogo na lamba 2 anaacha, which in the real sense kuna ng'ombe anafaa kuacha dairy meal, ni rare sana, si ndio? But because of the ketone bodies in the body and the ketosis issue, unapata ng'ombe anaacha chakula anaenda kando. And of course kutakuwa na decline in milk production, a severe one, na ng'ombe anakaa tu normal. Ukipima temperature, it's normal. So that is what we call ketosis. So we also, in such cases where an animal has used a lot of body reserves, then the animal will also come with what we call fatty liver disease. And reduced performance in terms of production, and also reproduction will be affected, because a cow with negative energy balance cannot come on it. And actually, the most the challenging issue that we have in most of our farms ni mambo na negative energy balance. Mkulima atakwambia tu huyu ng'ombe wangu amemaliza mwaka mzima na chakucha on hit. And if you address the issue of energy, you will be good to go, because in most cases what is making these animals not to come on hit is the negative energy. Ng'ombe tu akishaenda negative energy, kuirudisha kwanza ikuche normal will take around 2 to 3 months, because this is a nutrition intervention. So it means it's a slow process. So hata ukisynchronize haitashika, because the process of conception it needs a lot of energy. So even if you synchronize an animal which is having negative energy issue, the chances of conception is very low. So let us train our farmers to be more consistent in terms of feeds, especially on a transition cow. Because most of the issues that we are treating in the field could have been prevented through this nutrition. Sawa. So the dosage for white energy is normally 100 to 150 grams per cow per day. That is given preferably in the evening during milking. So 100 to 150. So in layman's language, unajua mkulima atakuuliza vichiko ngapi? Si ndio? Wanakuulizianga in terms of grams. Hata chumvi wanawaulizia in terms of grams. Sana sema napea tu vichiko ngapi, si ndio? Yeah? So hiyo vichiko ngapi, I think if hiyo ni ngapi kwa wala wamepeana hiyo advice. 10 grams is equivalent to vichiko ngapi? 10. Yeah? Ile kubwa. A scoop ile iko na mlima. Around kama ile kichiko kubwa, it should be si ile imewekwa mpaka inakuwa mlima, si ndio? Inaenda 10. But kama anaweka kama mpaka inakuwa na hiyo mlima, inaenda around 5. Si ndio? That is now 100 to 150 grams. But then remember, I say this product can also be used pre and post calving. It can be used to steam the cow and can also be used after calving. So what I normally advise farmer is when you are using to steam the cow, because now the cow is huge and issue na negative energy balance, ndio. So you advise the farmer, because of the cost implication, you can give around 50 to 80 grams. Hiyo ni vichiko 3. That is when you are steaming. Are you getting what I'm saying? Now, after calving, that is now when the energy demand in a shoot. Then you can now double the dose. Sawa, for 1 month or 2. Because it's normally the first 2 months when the cow is coming down with negative energy balance. Sawa. So that is the dosage for that treatment. So we've talked a lot on the prevention, and we've said for prevention, because it is a metabolic disease, you do what we call nutritional intervention, and we've said that. Now, when it comes to treatment, remember, this is non-infectious. So you don't rush to antibiotic. You rush to something that will restore the metabolism of that animal, not antibiotic. That is the primary treatment. Before you come now, kama kuna issue na soil ulcers, nini, ukuche na antibiotic. Sawa. So for our case here, we are talking of metaphors. So metaphors, for those of us who have used, is a product it's a metabolic stimulant. So remember, it has butaphosphan, which is 17% phosphorus, and also cyanocopalamin. So the cyanocopalamin is the vitamin B12. And then we have the butaphosphan, which is 17.3% phosphorus. This is a case of laminitis. So a case of laminitis will need a metabolic stimulant, first of all. So ukifika kwa farm, you are treating a case of laminitis, usianze na bench strep. Sawa sawa. You start with Metaphos, of course, which is a metabolic stimulant, which will then help that cow to restore the issue of laminitis. So Metaphos is a veterinary tonic and metabolic stimulant, and it's used for prevention or treatment of deficiencies of vitamin B12 and phosphorus in cattle. So I said vitamin B12 is the cyanocopalamin in it, and then the B, that's phosphorus, is also in that butaphosphan. So basically, that is the product that should be used for treatment of the laminitis. Okay, so much has been said about laminitis. Remember, we are talking about lameness in animals, and so we have other several factors that may cause lameness in animals. It's not only laminitis. We have other issues that may come in to cause lameness in animal. So we have other common food-related issues, and the most common one is this one, the foot rot. I think we've had a lot of cases. From this picture, mungeona vizuri, like when you talk of foot rot, there is rotting in the food. Sindio? And in most cases, foot rot inaenda hand in hand sana sana na laminitis, because when the hoof of an animal is compromised, there will be a lot of opportunistic diseases that will come along with it, because the sole will be soft and all the other structures will be much compromised, and therefore we'll have a lot of issues. So foot rot is caused by a specific bacteria, an aerobic bacteria for this matter. There is a bacteria called Fusobacterium negrophorum. So foot rot is a disease that normally comes along with laminitis in most cases. And we say that the major routine practice that we should practice in the farm is hoof trimming. And when we do the hoof trimming, this case of foot rot also will be a case that will be intervened when you do hoof trimming. So we are saying foot rot is caused by a specific bacteria that came into the tissue of the foot via the skin defect. That means foot rot cannot come in when you don't have issues with sole ulceration, because the bacteria will not get a gateway to the hoof. So when we have a skin defect, so most of the defects come from the trauma or condition that predispose the cattle to interdigital skin damage. We also have another case called interdigital dermatitis. When you say interdigital dermatitis, that means the skin in between the interdigital, the skin between the two claws. When it is affected, there will be an inflammation of the skin surrounding it. So that is what we call digital dermatitis. Or sometimes there's a name. There's a name. Is it the heel warts? Yeah, something of that sort. And it is caused by the spirochetes of the genus Treponema. So as you can see, the reason we are calling it the heel warts is because of how it shows. As you can see, inakaa kama ile warts ya ng'ombe. Yeah? Sunaona? So this is the hoof, the underneath of the hoof, and then we, in between the digits we have these things. Ukifungua tu ukiosha vizuri na utaona such things like coliforms. So that's what we call digital dermatitis. And then of course it will then result in ulceration. It will graduate into ulcers thereafter because it will peel off. So we will have the ulcers, as you can see, in between the digits. So the skin will be inflamed, and then we will have the issue of what we call interdigital dermatitis. We also have sole ulceration. Sole ulceration is the gateway to many issues that we are having. Because tulisema, okay, the first one is laminitis, which is a metabolic. It is non-infectious. Sindio? And then we have now other issues that is coming through the sole ulceration. So when the sole, when the hoof sole is traumatized, or has some trauma, or some wounds, then it acts as the gateway to other pathogenic infections in the hoof. So sole ulcers are caused by disruption of the normal horn-producing cells in a discrete area below the digital cushion due to pressure from unstable maybe ground. This disruption in horn production eventually leads to defects in the sole and the protrusion of the corium. And remember, the corium is the most sensitive part of the hoof. So when it is exposed, of course, we'll have sole ulceration. There's also white line disease. This one we talked about. The white line disease is related to laminitis. This one is more of metabolic because of the changes that comes with the inflammation of the lamina. So we will also have a case of white line disease. So, vile nilisema, the white line is just underneath the hoof. It is just underneath the hoof. So, when there is laminitis, which was the line, okay, we have the hoof wall, and then the white line lining the hoof, and then we have now the lamina. Or the lamina. So when the lamina is inflamed, that means even the white skin, the white, the white line will also be affected. And as I've said, it is more of metabolic rather than infectious. So this is basically what I wanted to show you, like the white line. When you have the white line is here, number 4. So it's between the hoof wall and then the lamina. So in between is the white line. So that is also a very important structure in the hoof of an animal. There is also something that I wanted to talk about. There is this sesamoid, or what you call the navicular bone. What is the function? Ni kadogo, but it has a very important role in the hoof of an animal. When the animal is moving, remember, the hoof of an animal, sometimes the attachment, because of the laminitis, the petal bone will be, the bone between the petal bone and the hoof wall will be weak. And therefore, the petal bone will be moving, will be rotating, because there is no bond. Sindio? No, now the distal or the navicular bone will then act as the fulcrum, bearing the weight of an animal. You remember the fulcrum, what do you call in physics? Kazi yake ilikuwa nini? Stability, sindio? Ama ilikuwa nini, sindio? Yeah. So the navicular bone will then, even in the normal locomotion of an animal, it acts as the fulcrum. It acts as the fulcrum that bears the weight, or rather the pressure of the weight of the animal when it is moving, so that the animal, the weight of the animal will be evenly distributed, so that you don't have issue. Of course, we have other structures. We have what we call the long pattern bone, and then we have the short pattern bone before the petal one. So the function of these structures is to give support to the hoof of the animal, and also provide shape for the hoof. And then we have the flexor tendon, which is very important when the animal is moving. So when the animal is moving, we have the distal interdigital flexor, which helps to flex the joint when the animal is moving. So basically, that is what I wanted to say. And as we've said, and as I said earlier, lameness may not directly affect the production of the animal, like laminitis, like mastitis, or any other disease. But remember, this lameness inachangia vitu mingi. One, if the animal is lame, that means haezi enda kukunywa maji. Si ni kweli? Na maji ni 87% of milk content. Ni nini? Ni maji. Number 2, ng'ombe haezi tembea kukula. That means we will also have reduced what? Production in terms of milk, and even beef for the feedlot. So it may not directly affect production, but inachangia sana, and also the welfare of the animal also. Yeah, when the animal is in pain, you should also consider the issue of welfare. Sindio? Yeah. So I think that's all I had for this presentation. I welcome. We have 20 minutes remaining for comments, and for questions. And as I've said, this is an interactive session. We can engage through questions and answers. So, anyone with a question? You mean mchai kuwa na issues na laminitis? Yeah? Okay, what's the intervention for foot rot? When you have a case of foot rot in the farm, unafanya aje? Yeah? You use copper 2 sulfates, ndio? Yeah? Is that the only thing we do? You treat, ndio? Because we said, okay, the primary intervention is the copper 2 sulfate, and then which will work on the bacteria, that is the fusobacterium, and then you now narrow down to other clinicals showing of the animal that maybe you have sole ulceration, so you do what we call you use antibiotics to treat such cases. So, any question? Yes.
I need a clarification.
Yes.
So, you said when the bacteria produce toxins, they actually impair blood supply to the lamina. After the impairment, it leads to necrosis. Now I'm wondering, can a necrotic part be treated? Because you have given us some drugs that you can use to treat laminitis. Can you treat a necrotic part?
Yes. And if you have an answer to that, as I've said, it's an interactive session.
Thank you. My question is, what could be the fate of acid in the rumen? Is it just to kill the microorganisms leading into toxins? What are the other effects of those acids? Thank you.
If I may ask, how available is the white energy and what is the cost?
Okay, thank you. Okay, who has an answer to the first question? Who can? So the first question is that we talked of the necrosis. Do you have the image? Yeah. So we were talking about the corium, the necrosis of the corium, and also the hemorrhages that comes alongside when the hoof is affected. Sindio? And we say that the first intervention that you should do ni mambo na nutrients. Sindio? And then we narrow down to now you treat the cow now symptomatic. Sindio? Symptomatic. Now, when we were talking about the intervention, we talked of hoof trimming. That means the necrotic part, ishakufa, sindio? And that means that part should be trimmed off. Baka upate mahali kuna fresh blood supply. Sawa sawa. So the necrotic part, when you are in the, when you are treating the laminitis case, the first thing that you should do is hoof trimming. You trim the part that has already died. Sawa sawa. So you trim it. Ukishapata sasa mahali kuna abscess ama kuna nini, unaosha na maybe disinfectant, and then now you do the systemic injection, maybe to kill the bacteria. But then the primary intervention is on nutrients, and then number 2, now you come to the affected claw directly, and then you trim off the dead cells or the necrotic part, and then you now treat it systemic. Sawa sawa. Another question was, okay, the fate of acid. Yeah, the excess lactic acid. I think that one now requires the pathway explanation, because remember, we also need this fatty, maybe these fatty acids to provide energy for the animal. Sindio? So basically, we were talking of excess lactic acid in the body, because we cannot say even the acids in the rumen yote ni mbaya, because we also have the hydrochloric acid, and it has a very important role in the digestion. Sindio? So we are talking of excess lactic acid, because basically we are talking of grain overload. Grain overload. That means there will be excess production of carbohydrate. Breaking the carbohydrate will be fermented, and then there will be production of lactic acid. Excessive production of lactic acid, which will then kills the bacteria in the rumen. And of course, you know what you normally do when you have cases of grain overload. Mnapea nini ng'ombe kama ng'ombe amekula a lot of grains? Yeah? Epsom salts. Yeah? Is that the primary? Okay, hiyo inasaidia tu ng'ombe kutoa, sindio? But then how do you neutralize the pH now? Because what is making the cow to plot? Yes? Ni nini nafanya ng'ombe ina float? Yes. So you are stretching.
I can as well say something. So somewhere, I'm saying over the issue of grain overload. Most of the time we do use the sodium. The sodium, the one that we use, kunda mandasi, that's the best. A baking powder is the best to treat that. Get one around 2 liters of water, then you put that packet or of it, then you give that animal. The problem is over. At the same time, I'm coming back to what we were saying about hoofs. I deal with a lot of, especially I deal with Poran cows, and then we have around 7,000 cows. That's Poran. And then what we do with hoofs, if there is some hoofs that are grown, I can say they are born is something that is natural. When the cow gives that calf, you get that the hooves are growing curved in a way. When it is curved, what we always do, we call that calf, no matter the age of that calf nor the cow, we do culling. Now, are we supposed to do hoof trimming to something like genetic? You know that is genetic because once that calf is young, always you see the hoofs are being curved like that when they are growing. And when it puts on weight, then that cow will not walk. Then the problem of laminitis comes in. So in our farm, what we could do, I do dairy estate. So what we do, we cull all those calves, cows with hoof problem. Thank you.
Okay, that's interesting. So we have congenital hoof issues there. Yes? Okay. It's in that miniature, I'm just thinking like, when a calf is born with okay, when do you realize that the calf has this hoof issue? Immediately they are born or yeah? At 8 months. So I'm just thinking between day 0 or day 1 and 8 months. Is yeah? So when you ukiona tu ako na hiyo issue, you just give it time apate tu. Okay, me I think it's doable. You can trim, you can do hoof trimming when the calf is still young, because after in fact when it's still young, trimming becomes easy because the hoof is still soft. Sindio? Because if you leave it now for to grow for some time, it will undergo keratinization, all that, inakuwa ngumu. So even doing hoof trimming after 8 months will be a great problem. But if you can do it kama bado ako mdogo, I think it's possible. Yeah, I think it's possible. And then on the issue of crane overload, I think hiyo ya pecking border, I think hiyo inafanya. Sindio? But were we trained to use pecking border? Eh? Of course, I know our profession is an art. Sindio? Saa zingine you use this, ikikata unaenda hii. But it really works because what we are just trying to do is in crane overload, there is excessive production of the lactic acid. Sindio? So, using pecking border, which is a paste, sindio, will then bring back the pH almost to normalcy, because you are trying to balance now between the acid and the base, so it will bring it to the normalcy or neutral bath, that is around 6 point something to 7. I think the rumen should be slightly acidic because of the hydrochloric acids that are in the stomach. Sindio hivyo? Yeah. And then there was another question. Alkaline.
Yeah, I'm saying that in the rumen the pH should be alkaline, but as we proceed now to the true stomach, that's the then we now get into acidity. But the 4 stomachs purely alkaline, so HCl should not be part of that in the rumen. But in the true stomach, HCl is there.
Can you confirm?
He's right.
Okay, and then the last question was on white energy. So white energy is available in 1 kilo and 25 kilos package. So for 1 kilo, they are locally available. You can, unaweza ona stockists wenye wako hapa, nimeona Betu Wafula huko, ako nayo, Wasenkishu, you can talk with her. We have Dr. Musembi, we have Dr. Cherutich here. We have a lot of our distributors here. So we have them locally. For the prices, it normally ranges from 1,100 to 1,200 based on mahali iko. Unajua kama ni mashinani hata factory in mambo na transportation. But it is, as I said, isi chumvi. So it normally used on a transition cow. It's a special product. And actually, najua mkulima atakwambia, sasa with that price, you are still 1,000 or 1,200, atasema maybe like mambo na expensive, sindio? But one thing that I can tell you is, when you use white energy boost calving, singomba anafaa kupata tuseme dairy meal maybe 6 kilos. But when you use white energy, you reduce the amount of dairy meal you give to your cow, because white energy gives almost twice the energy ile ngomba anapata from dairy meal. So that means you cover the cost by reducing the what? The dairy meal, and you will still get the same the same results. And number 2, utakuwa umeavoid mambo na lactic acid, because we said white energy is a rumen bypass fat. That means it goes directly to the bloodstream, and na inafanya kazi within 24 hours. Another thing, simumesema mambo na pecking border. I have seen people using white energy on a recumbent cow. So what you do, unaongeza kwa maji, unachanganya, unatengeneza kama uji, unampatia ng'ombe. Kama uko mahali kupata ketonix ama hiyo ingine ya nguvu iko mbali, you can still use it. You can tengeneza kauchi na white energy, ng'ombe anakunywa, and it has really worked. So it's possible. This thing is it's a wonderful product. Number 2, you can also have it in when you are doing the feed ratio. Kama we ni mtu wa kuchanganya feeds nyumbani, you can always incorporate white energy in your feed ratio. Yeah. So any other question or a comment? Yes. We have some around 5 minutes, so we can have a comment or a question. Yes.
My question is, why is it that overgrown hoofs are more common on zero-crest animals than the free-range animals?
Umesikia swali? Who is in a better position to answer her? Why is it that animal, most the zero-crest animal are predisposed much to hoof crowing than the one in the pasture? Yeah?
I think on your earlier presentation, you said zero-crest animals are on hard floor.
Yeah, yes. Okay.
So that's the reason why we normally have those problems of the hoofs on zero-crest animals than the animals which are being raised in the field.
I don't know whether that. Okay, yes, I think basically that is it, because when you constantly stand or walk in a hard surface, there is tendency of that the wrapping of the hoof versus the hard surface. I'm trying to put it. I don't know how I should put it. Like when the animal stands akisimama sana on a hard surface, that hoof is made of live cells. Si tulisema hivyo, there are own cells that are constantly growing. Si ni ukweli? But now, when you are stepping on a hard surface, that means the own cells will tend to grow alongside the flow of the structure. Sawa? Or anyone else has a better explanation to that? because basically we are talking of the own cells that are growing on the hoof. So making the so the hoof will grow, the horn will grow. There is tendency of the horn hoof growing alongside the concrete floor because of the horn cells. Okay, there's a comment from online. Emi Cheruto is commenting. He's saying that this is due to pressure exerted to the earth surface. I think basically that is what we are saying. Yeah.
Yes, I can see somebody's hand is up. And I'm here to bring you the mic.
Okay, thank you. I've been attending some animals on zero grazing, but they are not on concreted area. They are normally on sawdust, but shaded area, and they really have a lot of problems on the overgrown hoofs.
Yes, I said when I was doing an introduction, I said hoof trimming should be done both on the bastard animal and the zero graze, because hoof growing is a constant thing. Sawa sawa. So even on the soft surface, there will still be overgrown hoofs, regardless. But the most predisposed animal are the one on the other surface. That means we are not saying even those on the other surface hawatakuwa na hiyo shida ya hoof growing. Sawa sawa. Another question, an online question.
Sorry.
So the question, is it the same, Emma? Or who is it? So Jerob is asking what can be done for immediate relief of pain, since the nutritional intervention may take time to respond. Exactly. See, we said this is a laminitis case. And of course, we have the cardinal signs of inflammation. We have the pain, we have we have the swelling and all that. So I said primarily what you should be done is that you should use a metabolic stimulant, because this is a metabolic issue. But then alongside that treatment, you now treat the cow clinically based on the symptoms. So, kama ng'ombe anaonyesha pain, you do the pain intervention. Sawa sawa. So what we use the drugs that are available in the market for suppressing the pain. You all know what you've been using in the field. So I was just saying this is a metabolic issue, and therefore you should primarily treat it with a metabolic stimulant. But alongside that, remember, we have the other signs, the clinical signs, the cardinal signs of inflammation we are talking about. Of course, pain is one of them. And therefore, you should use a drug that will counter the pain, and also an anti-inflammatory drug because of the swelling also. So that doesn't mean you are treating laminitis. I don't know whether we are in the right or on the same. Yes. When you are using an analgesic or a drug that is used for treatment of maybe you are countering the pain, or maybe you are countering the swelling, or maybe you are countering the abscess that comes alongside the laminitis, you are not treating laminitis. You are treating common pain, you are treating pain. But primarily, what you should use to treat laminitis is a metabolic stimulant, like Metafos, a drug that has butyrphosphine and cyanocobalamin. I think that's...
Yes, hata mimi niko na swali.
Okay.
Is it good to hoof trim? Ukipata laminitis, as you treat, you hoof trim at that time.
Okay.
Maybe in brief, Does the white line, the product you've talked about, the white line, does it have a positive effect on the milk fat content as opposed to the normal microbial fermentation that takes place in the rumen?
Very good. Okay. Maybe I should answer the 2 questions and then we should be winding because it's time. Now, number 1 is talking of hoof trimming when you are treating laminitis. We said you should do so because already you have a necrotic tissue. So there is no way there is no way you'll get over the necrotic tissues without what? Trimming. Then number 2 on white energy. White energy is also used to correct the butterfat content in animals, but chunga tu isikuwe excess, especially in Holsteins. Remember, we have those animals that naturally have what we issues with butterfat content. Maziwa yao ni nyepesi sana, si ndio? So kuna watu wakichukua maziwa kwa cooperatives wanaambiwa wameongeza maji na wachaongeza, si ndio? They can use white energy to correct it, but not exceedingly, because ukipea ng'ombe around 200 grams, the butterfat content will shoot more than 5. So kuna wale watu tena wakienda wanaambiwa umeongeza pecking border. So kuna watu kama hawa. So instead of correcting now from watery to normal, itaenda sasa pecking border. So what we are saying is white energy is used for correcting the butterfat issues ya maziwa. So with that, I think we are through, and thank you so much for your time, and hope that at least you've gained something, and have a very nice afternoon. Thank you so much. Back to you, MC.
Unajua ile tunapiga makofi kienyeji na nimeona hamjarara, na unajua sio normal sana ati the time between 11 na 1 hamjarara sana. Kwa hivyo lazima presenter amejua kufanya mambo hapa na pale, alafu mnampigia makofi ya kienyeji. Kwani nyinyi sio wagwana? Nyinyi wagwana? Nataka tupige ile makofi huwa hailii. Mnaijua? Hebu pigeni nione ile hailii. Hebu pigeni 1. Ona. Sasa hebu piga 1. Ay. Nataka ile makofi hailii. 1. Hey, nini hiyo imelia? Hebu piga 1. Oh, ati ni hoof. Unajua wale watu tunakuwa Facebook siku hizi tunaonaga profesa, wale watu wa mlima tunaona kufai. Alafu ukienda bado hiyo Facebook kuna jamaa wawili, hebu andika pahali Nate the hoof guy, Nate the hoof guy, andika hivyo ndio ukienda Facebook umtafute Nate the hoof guy. Na kuna mwingine anaitwa the hoof GP, ukienda umtafute. Hii mambo yote sasa sababu ya ni kukata, trimming, akielezea ujue pahali white line iko, ujue sasa zingine kuna build pressure unatoa. It will be very informative. Sawa? Umeandika the hoof GP na Nate the hoof guy. Sasa turudi kwa makofi. Nataka tupige 5 yenye haili. Ikilia moja tu tunarudia. Lakini tukirudia mwenye amefanya ilie anakuwa amesimama. Si hapo ni sawa? 1. Haya, tafadhali. Salimia mimi. Haya, tunarudia. 1, 2, 3, 4, 5. Asante sana. Sasa ukiona na shida nikiangalia hapa nje sababu mchere haijafika lakini wanasaini ya mwisho wakisaini saa hii watakula waende wape ng'ombe yai. which is very important actually. Mnanijua vile naitwa? Naitwa nani? What's my name? What's my name? Mimi naitwa Oreste Karaja wa Kuria. Oreste Karaja Arab Kuria. Nimetoka Murang'a County. Mimi ni wa attack. Na mimi sababu most of you are paraprofessionals, ni mimi mlichagua niende huko board. Nikawatetee, nikawa represent. Unajua kuna tofauti ya kuteta na kurepresent. Ndio tukiajiri inspectors, tunaajiri paraprofessionals kadhaa na surgeons kadhaa. Sawa? Ndio mambo ikienda hapa, tukiwa hapo, unajua pahali msifinywe sana. And we have tried to our best. Nimeenda miaka 2, nimebakisha 1. Na hiyo miaka 2 simmekibia. Simmekibia. Sidio. Simumeona magari kena namba plate ya blue. Sasa ile kazi mlinituma ni twende tujaribu kufukuza kwake. Ndio paraprofessionals wapate kazi. Sidio? Saa hizi tukiangalia outlook ni vile ilisimama kidogo juu ya siasa kidogo hapa na pale. Sasa paraprofessional alikuwa the most sought out person. Ukienda kwa ward ulikuwa unapata chat 20. This agrovet requires trained, registered by the. Now, in the next 1-2 years, kulingana na projections, if inspections are done, we will have created 15,000 jobs for veterinary paraprofessionals. Hata ni wale hakuna. Karibu twende to import Uganda na Tanzania. So in the next 1-2 years, kama uko hapa na ile kajobu unafanya, unaona haupelekwi vizuri, itakuwa inahitajika pahali pengine wanakuhitaji pahali kuliko pahali yuko. Kwa hivyo hata kama saa zingine mna complain mnafinywa kidogo, saa zingine kwa Kikuyu tunasema unafinya ukikuwa na muiba. Ukikuwa na muiba, kuna kuwa na muiba na nini? Na uzaha. Unafinya zote zinatoka. Sidio? Kwa hivyo saa zingine si hata mmekuja hapa sababu mnataka you want to be on the right side of the law. Inaweza kuwa haijaanza kulipa vizuri sababu kuna kakwaka hapo na hapo kanakula ile pesa ungekula, lakini ijapokuwa ni vile serikali imefinya sisi kidogo. Si ulisikia all state corporations zinatolewa 30% ya budget. Kwa hivyo tunapata inspectors wako, magari ni kidogo. Kama yule ni inspector sasa lazima akuje hapa angalia CPD sababu hana gari ya kwenda field. Lakini hiyo tumabo kidogo kidogo. We solve as we go forward. Na nyinyi mkiweza, kama ni retention lipa hiyo 1,000, ndio yule jamaa akuje kwako, afukuze neighbor mwenye si trained. Sidio? Kwa hayo machache na mengi na madogo, sababu naona mchere imefika, nataka mtu mmoja aobeshe chakula. akiopesha, akimaliza niwape dakika 5. Tulisema ni vibaya sana ukuje CPD hii na phone book iende nyumbani vile ilikuja. Itaonyesha hauko serious. Kama mimi pale kuna mtu nataka niombe namba yake, at least ndio na leo ladies zile CPD nimekuwa nikienda, ladies ni wengi kuliko gentlemen, lakini ya leo